Welcome to Understanding the Evolutionary Stress Framework, a plain language guide on a new way to think about autism. This framework explores why autistic people develop differently, why health suffers, and what needs to change. For decades, the debate on autism has centered on whether it's a medical disorder or a natural difference. The Evolutionary Stress Framework, or ESF, proposes that the argument itself is the problem. It connects biology, psychology, and environment, suggesting that neurodevelopmental variation emerges through how the brain-body system manages energy and stress. We've seen four main ways of viewing autism: the medical model, the social model, the biopsychosocial model, and hybrid approaches. While each model contributes essential insights, none provides a complete, process-level explanation of how autism emerges. The core gap is the lack of a process-level explanation. We need a mechanism that shows how biology, psychology, and environment continuously shape each other across development to produce the patterns we observe. The previous models describe pieces of the picture, but not how the whole picture emerges. The neurodiversity paradigm achieved a crucial reframing, recognizing neurological differences as natural human variation, not pathology. However, it is primarily ethical and philosophical. It tells us how to value neurodiversity, but lacks the scientific architecture to explain how it develops or why health suffers. The ESF offers this scientific architecture. The ESF is built on four core ideas: energy and prediction, strengths and vulnerabilities, developmental calibration, and disorder as system state. It connects biology, psychology, and environment through energy regulation and predictive processing to explain how neurodevelopmental variation emerges and why health suffers. Idea 1. Energy and prediction is the common currency. Your brain is an energy management organ that uses allostasis, continuous adjustment, to predict and prepare for needs. Stress is redefined as the energetic work of maintaining coherence when predictions fail or demands exceed capacity. Idea 2. Development shapes regulatory strategy through adaptive calibration. Early environments tune the stress response system. These calibrations stabilize over time, emerging into characteristic neurotypes through the ongoing interaction of biology and environment. Autistic traits, such as sensory sensitivities or intense focus, reflect these regulatory strategies. Idea 3. Disorder is a state of the system, not a property of the person. Disorder is redefined as stress incoherence, a state where a person's internal calibrations no longer align with their current environment. The implication is that intervention should aim to restore coherence, not fix a broken person. Idea 4. Strengths and vulnerabilities are inseparable. For example, sensory precision enables pattern detection, but can lead to overwhelm. Reducing vulnerability without altering the strength is impossible. Support means designing environments that reduce the costs of a given calibration while preserving its benefits. The ESF explains several phenomena. It shows why the same person can thrive and collapse, clarifies the shared origins of health clusters, explains burnout as allostatic overload, and highlights masking cost as unsustainable dual processing. The ESF explains why the same person can thrive and collapse. When the fit between calibration and environment is good, the system runs efficiently. When the fit breaks down due to overload or insufficient rest, the system faces energy depletion. The architecture didn't change. The fit between architecture and environment did. Autistic people often experience clusters of health problems, such as gastrointestinal and immune issues. The ESF suggests these are not separate disorders, but rather manifestations of chronic strain. The same stress-energy architecture regulates multiple systems, meaning breakdown cascades across them. Support must treat the person as an integrated energy-regulating system. Autistic burnout is chronic exhaustion, explained as allostatic overload from sustained mismatch. Masking, or sustained dual processing, involves managing the environment while suppressing natural signals, doubling the metabolic cost of interaction. Suppressing natural regulatory strategies is energetically unsustainable over time, leading to significant mental health challenges. The ESF shifts the focus from fixing the person to supporting sustainable regulation. This includes biological support to reduce metabolic burden, psychological support to recognize internal signals before crisis, and environmental support to share the regulatory labor and provide predictability. The shift is from accommodation to co-regulation. Current frameworks emphasize adjustments for individuals, viewing the environment as making exceptions. The ESF promotes co-regulation, designing environments as active participants in regulatory dynamics through predictable routines, appropriate spaces, and respecting different energy rhythms. The ESF is a framework that organizes knowledge about autism, stress, energy, development, and environment. It generates falsifiable predictions and draws on research from stress physiology and complexity science. Importantly, the ESF is not a diagnosis, a claim that stress causes autism, or a justification for denying support. The ESF connects existing models. While the medical model asks, what is wrong? And the social model asks, what barriers exist? The ESF asks, what are the energy dynamics, and how can we support sustainable regulation? It integrates the insights of the medical, social, BPS, and neurodiversity models through the lens of energy regulation and predictive processing. For autistic individuals, the ESF shows that struggles often stem from an unsustainable fit between regulatory strategy and environment, not random deficits. For parents, a child's variability reflects regulatory interaction, not willfulness. For clinicians, the shift is to ask, what is this behavior regulating, and how can we meet that need more sustainably? For employers, educators, and policymakers, imposing uniform expectations sacrifices adaptive capacity. The ESF encourages designing for temporal flexibility, sensory design, supportive communication structures, and measuring outcomes based on results, not conformity. Inclusion is an ecological practice that sustains adaptive diversity. Key terms include adaptive calibration, the developmental tuning of the stress response system; allostasis, stability through continuous predictive adjustment; allostatic load, the cumulative cost of regulatory adjustment; and stress incoherence, a state of chronic prediction failure and energy depletion in the system. Paper 1, the framework, introduces the ESF as a paradigm. Paper 2, the formal model, specifies the developmental manifold, making the ESF mathematically precise and empirically testable. Together, they frame autism as an emergent developmental phenomenon, not a fixed disorder. The ESF aims not to make autistic people look typical, but to understand the energy landscape to find viable, sustainable paths. This involves knowing the energy landscape, reading regulatory signals, and designing for fit to support coherent regulation for diverse people. Thank you for viewing this video.